Hello, everyone. I'm Nancy Schulz, your 3rd District County Commissioner for Newton County. I hope everyone is staying safe and following the CDC and state guidelines. I know this has been a really tough time for everyone. It has been for me and for my family. But there is a silver lining. We've been very resilient as a community. We've shown what it means in Newton County to love thy neighbor as thyself. Our community has really stepped up to take care of each other. Now, every day we get some new information. Some of it is good and some of it is misleading. And soon we will be opening more businesses. So I'd like to use this opportunity to take social media and visit with an expert that's been on the front line of our pandemic and have this expert answer some of your questions. So today we're going to talk with Dr. Audrey Arona. Now, Dr. Audrey Arona is the CEO and District Health Director for Gwinnett, Newton, and Rockdale County. She's been an amazing resource for our community. She's assisted us as elected leaders, civic organizations, and churches determine what is best for our community during this pandemic. So, without further ado, let's welcome Dr. Arona. Thank you, Dr. Arona, for being here today and taking time from your busy schedule to answer some of our questions.
Absolutely. Very happy to be here.
I know that there's been a lot of developments in the last 24 hours, and we're getting ready to open up some businesses on Friday and some more businesses on Monday. So I've had conversations with a lot of my constituents, and even had a conversation this morning with some local businesses. And so a lot of the questions are coming from those conversations. So if you're ready, let's just dig in.
Okay.
We see that the numbers in Newton County are still increasing, and we're not really sure what that means. Are they slowing down? Are they still ramping up? And in that, we don't see a lot of information about recovery statistics.
Right. And it's important to know that since March, mid-March, we've been doing testing, but because of the limitation of test kits, we've only been able to test a small percentage of the population and those at greatest risk. For instance, we were only testing symptomatic healthcare workers, first responders, people who live or work in a congregate setting, that type of thing, or were exposed families, to them. Now we're opening that up to the symptomatic community, primarily because we have more test kits. We've always been limited by the number of test kits we have. So now that we have more, we can open that up and test more people. But you're right, the number recovered is not being captured. And I know in other states in the US, they're reporting recovered numbers, but the definition of that is what we really need to pay attention to. And remember that people don't report their recoveries. And so when we test people and they're positive and they don't require hospitalization, you can have a presumption that they recovered because not all of cases are hospitalized. And that's the only part that we're really receiving, the only ones we're receiving are the ones that are tested. So the recovery rate is kind of impossible at this point to really grasp. That's why it's not being reported. I think it's important when you report data to make sure it's the right data and also that it's accurate. And I think that's why it's not being reported.
So given data, I know that as a medical community, it's really important to base decisions on empirical data. We have a new drive-through testing facility at the horse park. Can you tell us a little bit about that and the procedure that's necessary if you want to get tested?
Right. Well, as most of you know, last Thursday we had the International Horse Park as kind of a pilot site for a larger drive-through testing now that we have more test kits. It was immensely successful. We wanted to test about 400 people. We had 400 people scheduled for that before, a day before even. So we were definitely filled up and it went very, very smoothly. It was designed, it's a wonderful facility because You essentially drive right through the building. It's the perfect location for such a structure like, and a plan like we had. And looking back on it, on average, it took about 6 minutes for each car, once they entered the facility, to pulling back out and being finished. So it was very efficient. We had the National Guard with us. Test results were all in. I think we called our last few that we had returned positive yesterday. So we got them to, the test results turned around very quickly. And we plan to have more drive-through sites just like that, depending, of course, on community awareness or public awareness, which is part of why, I jumped on this opportunity to be with you. And then also based on our test kit supply. So tomorrow we're doing a bigger one in Gwinnett County at Infinite Energy Center at one of their parking decks. And we have over 800 people scheduled.
Wow. So is the one at the horse park that was just for last week, or is that ongoing?
That was just one day last week. Every other day of the week, this week and future weeks to come, we're either at Newton County Health Center or we're at Cousins Elementary. And so this week we're at Cousins Elementary testing every other day. But we do plan, if we can get enough test kits, to plan those bigger drive-through test sites, because we can do more in one day and capture more. It just gives the public a lot of confidence to know if they're positive or not.
Right. And now those are for individuals who display symptoms, correct?
Right. Only symptomatic people are what we want to test. It's really hard to test people without symptoms, because if they're negative today, how do you know they're not going to be positive tomorrow or next week? And so when you're limited on resources and test kits, it's really hard to capture the asymptomatic group, even though that's been thought to represent even up to 25% of the population.
So that's one of the questions that I received from one of the business owners who is looking to reopen on Friday about testing his workers before he reopens, and those workers would be asymptomatic. And what do they, how does he have an assurance that he's going to be bringing back workers that are not going to put his customers at risk?
Right, that's a great question. And my best advice would be, first of all, don't let anyone return to work that's ill, okay? And secondly, screen your employees before they come in. Take their temperatures. We do that here at the health department and all of our health centers and even our district office. And we ask the questions: have you had a cough, fever in the last, 24 hours or before you came? And we check their temperatures on a infrared digital temperature device, and we record that every day. And then if someone becomes ill during the day, we just encourage them to actually, we encourage them to come behind our building and get tested, of course. But that's when you would arrange testing for that individual.
So I know that one of the recommendations is that if you do have an individual that is that displays symptoms, that they should not report to work, and that they should isolate for 7 days. Is that correct?
Well, right. I mean, that's my first thing. If you're ill, go home, but call this number. Let me get it for you. It's 770-513-5631. Call that number and arrange a test. And meanwhile, isolate yourself at home just in case. And if you get a test and you're negative, then you should follow normal criteria for returning to work, where you're without a fever, not using medications to lower fever for 24 hours. But if you're positive for COVID-19, then what you do is you go home and you isolate yourself for a minimum of 7 days, or 3 days without a fever and decreasing symptoms. And we say decreased symptoms because some people have a cough that lingers, but as long as it's better, and you've either, whichever one is longer, that 7-day period or the 3 days without fever and better symptoms. So that's the recommendation. Some employers are requiring a negative test to come back to work. And if so, I would just call that same number I gave you and arrange to have that test, and we can give you copies and that kind of thing.
The last question I have on testing is related to, we hear a lot about testing, tracing, and isolation. Can you give us a little, can you explain those three terms for us?
Yes,
Why
absolutely.
they're used together?
Right. It's important because from public health, you know, when you have a disease or a virus like this, you want to try to contain the spread. So if someone tests, of course, the testing is to see whether you have it or not. So if you have COVID-19, then the contact tracing means that someone from our health department will reach out to you and say, hey, you have a positive test. Who have you been around from the day you got sick 2 days prior to when you developed symptoms? Who were you around? And especially if that individual lived in a congregate setting like a nursing home, or worked in a nursing home or assisted living place or a prison or a jail, we really, really are concerned about those, because in that type of setting, this virus can spread pretty crazy, right? And so that's called an outbreak, and we want to minimize those. So we prioritize our investigations to those facilities, of course. But so contact tracing is basically just calling you and saying, hey, you're positive, who have you been around since you developed symptoms in 48 hours before, okay? Contact investigation then means that we contact the contacts that you gave us and said, hey, I was around my mother, or I had 4 coworkers that I was with. Then we would reach out to those individuals, find out if they're ill, get some information on them, and then also give them quarantine recommendations, which is now, look, you've been exposed to a positive person when they were ill, okay? And so therefore you need to go in quarantine for 14 days and monitor yourself for symptoms. So if they develop symptoms, they become a case. Of course, now we can test them to see if they are. But if they don't have symptoms for 14 days, then they're out of quarantine. I should say that at the very beginning, when this virus came, we were contacting every single positive. Then once it became so widespread in the community, we didn't have enough staff to be able to contact everyone. So we prioritized those contact tracing and investigations to long-term care facilities. But now there's a push with the state, now that we're doing increased testing, is to try to reach every single person now that's positive. So what we're doing, in addition to ramping up staff for testing, we're also ramping up staff for contact tracing and investigations.
A lot of responsibility goes back to individuals to make sure that they are protecting themselves and they are being responsible to their community. One of the data points that we see is that women and African Americans are disproportionately affected. Can you tell us a little bit about the factors that are underlying that data point?
Right, good question. And I'll start by saying that there may, in fact, be a difference between men and women. More lately, we're seeing that it's pretty equal. It depends on what information you're looking at, what website. And remember, there's always a lag in reporting. The hardest thing about the answer to that question is that all of that information is gathered at the time of an investigation, right? Your race, your ethnicity, all of that. Sometimes even male or female, because a lab form doesn't necessarily have that information, right? And so when you're positive for COVID-19, then you get a phone call and then you go into all of those things. And what's happened is that because our investigations were limited for a long period, well, for the last 2 weeks, we're limited to outbreaks in long-term care facilities. A lot of the people that have tested positive were not getting investigated. And now we're picking that back up. So you can see there's been a lot of blocks of information that are missing. So I hate to report data that isn't accurate. And I think with time and as we gain more bits of data and knowledge, and we're all obtaining the same information every time we, contact trace or do an investigation, then we'll have more answers to those questions. So at this point, I can't say that isn't a factor, but I think it remains to be seen if we're really going to see that change in that way. As far as keeping everyone safe and what you can do to keep yourself safe, it's really super important, even as you return to work, that you keep social distancing 6 feet apart from people. If you're returning to work and that is impossible to do, then you shouldn't return to work. So the good thing about all this, I'm very nervous with opening the public back up and loosening some of these restrictions because I'm afraid that our numbers are going to climb and we're going to be kind of where we started. which I really don't want to see, and as does no one.
Mhm.
But the important thing is there's been a lot of public education since 6 weeks ago. So I think everyone knows what it means to social distance and why it's important. And I think there's, like you said, a very important personal responsibility with every single citizen, no matter if they're off work, going to the grocery store, or in a workplace, to maintain those restrictions. Hand washing, wear a mask if you want to, especially in a crowded situation, maintain 6 feet apart, wash commonly touched surfaces. I think there's a lot that we can do to keep our community safe as we return to work.
So your background is as an OBGYN, and we haven't heard a lot about pregnant women and how they protect themselves, and what are their risks as they face delivery, their prenatal visits. Can you go into that a little bit for us?
Right, it's a very it's exciting time to be pregnant, and I loved my patients and loved delivering babies, and just that interaction is almost, such a happy time. And this doesn't have to be any different than that. You just have to be careful, social distance, wash your hands, cover your face and mouth, all that. We don't know if pregnant people really have a greater chance of getting sick from COVID-19, but we do know that pregnant women have a altered immune system while they're pregnant that could make them more at risk of becoming sick from viruses like COVID-19. There are changes in a female body when she's pregnant that increase, some of those infections, and pregnant people have a higher risk, we know, of having a more severe illness because of the altered immune system there. So I always tell patients, when you're pregnant, you do the same things, but you're just got 2 people in mind while you're doing this, and that is avoid people who are sick. Clean your hands often, disinfect surfaces frequently. There has not been shown to be mother to fetal transmission of the virus. That's really important. Mm-hmm. Most babies born to even COVID-19 positive mothers are negative. Okay. Those babies who have become positive, it's hard to know whether or not we think that was an exposure that occurred after delivery and not before. The virus has not been detected in amniotic fluid, has not been detected in breast milk or any other maternal body fluids. And so, breastfeeding provides so much protection to a baby across the board that we still recommend that. So there's a few things. If the mother is positive, has already delivered, and she wants to breastfeed, she can just keep her, hands clean and wear a mask when she's breastfeeding the baby, or if she wants to, express the milk and then give it to the baby after, that's fine. Just have to take those same measures as you would, and even using expressed milk and, the father getting to feed the baby during that time would be fine as well. So, but that's good news for people who are pregnant, because yes, there's concern. Just take care of yourself, drink a lot of water, which I always tell people, and try to keep yourself away from ill people.
With children, immunization schedules, stay on the immunization schedule.
Right, that's really important to do so. We have had altered ways of doing that. Sometimes we'll actually meet the people in the parking lot to give immunizations instead of having the parents and children come into the health centers. At this point, it's not okay to do home visits with vaccinations. That's not allowed by our VFC program, Vaccines for Children program. But we have had nurses go out to the cars when that's feasible, if there's a lot of children or not. But usually we'll ask them to mask, the parents mask them and the children, and of course the healthcare workers are as well. And so there's ways around that. But yes, try to stay on the same schedule if possible. The 16-year-old new vaccine that was for meningococcal vaccine that was added in 11th grade, because of COVID-19, that has been extended. The deadline for that's been extended. So that'll give us some time to catch up, given that the school's calendar was messed up a bit this year.
So I'm going to give you an opportunity to just give one last plug for how to keep yourself healthy during this time, and especially for seniors who seem to be at a higher rate of, who have a higher incidence rate. How do all of us stay healthy during this time so that we can fight this virus?
Well, it's such a great question, and I appreciate the opportunity to say this. I mean, really just be smart. It's amazing what has happened to our influenza season since everybody's been washing their hands, covering their mouth. It's been amazing. Our hospitals are usually flooded with patients and full, and this year we actually have a low census. So this works for a number of viruses, not just COVID-19. And so my advice is just to protect yourself, stay home if you're sick, stay away from people who are not. You know, you can still be wonderful, engaging people. Zoom works great, as you see. And I do that with my family once a week all over the country. In fact, we see each other more during this season than we have normally. And so there's various ways. We're so fortunate to live in a time when we have technology like this, so that we don't have to completely be isolated, if you will. But wash your hands, clean commonly touched surfaces, stay away from massive amounts of people, and protect our citizens. I tell the most at-risk people are still those over 65 and those in nursing homes and those with chronic illnesses. And so we just really need to protect them. And our elderly population, most of them served in wars and sacrificed a great amount of their life for us. And I think the least we can do is stay home and protect them.
This has been great. Thank you so much for taking time out. I know you've been really busy during this time. But you've been so accessible to those of us that are in positions of making decisions, and you stay safe as well. Thank you again.
Thank you. It was a pleasure.
Wow, that was great information from Dr. Arona. It was a nice opportunity to talk to someone who's been on the front lines of this pandemic and provide us really good information. Now, in Newton County, we've had some great people coming together in spirit to make sure we have all that we need as a community. Many of you have reached out to me about food, and we have 3 food pantry options. One is Covington First United Methodist Church, and their food pantry is on Mondays, Wednesdays, and Fridays. The second option is Willing Helpers, and their food pantry is on Tuesdays and Thursdays. And the third option is Springfield Baptist Church. If you'll reach out to them via email or phone, they will be happy to provide you with food. I have a flyer, and if you will email me at nancy@nancyschulz.com, or pick up the phone and call my number, 770-337-7562. I'll be happy to provide you the flyer with the addresses and the phone numbers and the times for those food pantries. You heard today that drive-through testing is available Monday through Friday. And I'm going to give you that phone number once again. It's 770-513-5631. You don't need a referral, but let's reserve it for people that have symptoms. We have only a few test kits available, and so these are for people that have symptoms, not for asymptomatic people. I will be happy to provide that information for you as well. And I look forward to seeing you again on one of these calls. I want to leave you with one piece of perspective. We say that we're all in this together. And as a community, it's important that we own that phrase. What does that mean? That means that we protect ourselves and we protect others. So as businesses start to open up, Let's be mindful of the people that are working in those businesses that provide us services, and make sure that we are protecting them while we are protecting ourselves. So let's move forward together, one Newton, and I'll see you next time.